Good afternoon, ladies and gentlemen. Welcome to the report back session. My name is Manfred Konokiewicz. I'm working for the German government, the Federal Ministry for Economic Cooperation and Development, and I'm the Director for Global and Sectoral Policies in that ministry. I'm quite thrilled and excited to have been invited to chair this session because Germany, the German government, is deeply committed to the issues we are discussing here today. Would like to remind you that we have committed $3 billion at the L'Aquila meeting, which you're all aware of, for food security and rural development in 2008. And we have also followed the invitation of our Canadian friends to join the Muskoka Initiative on Mother and Child Health, which was decided at the G8 summit last year, and we've made a commitment there of 4 billion euro over 5 years. So that makes it 400. I'm getting mixed up with the zeros. 400 million. That makes it 80 million per year. So we are deeply committed financially, and what comes out of the conference is very interesting for us. We're implementing these programs through our implementing organizations, GIZ and KfW. Now, I'm faced with the formidable challenge to manage this session, where we have 9 reports and 45 minutes. So for anyone who can calculate, that makes 5 minutes each. And to assist all the speakers in keeping the time, we have that nice little gadget there that will tell you your time and remind you it's running backwards. So when it says 1 minute, you have 1 minute left. It's not that you have just spoken that you have used up 1 minute. You have 1 minute left. So without further ado, I would like to go to the first report, and that is on economic levers. And that report will be given to us by Ashok Gulati from the International Food Policy Research Institute, IFPRI, and he is the director in Asia and located here in India. Please.
Thank you very much, Mr. Chair. I think within 5 minutes, if I have to do the business, I'm going to skip the slides that we have prepared. And what I'm going to speak here is on behalf of the team, the panelists there, and the entire participants there who did a great job. And the framework that we adopted was broadly the framework which the Prime Minister has elucidated in his opening inaugural address, that there are 3 parts that we need to look at: availability, economic access, and the issue of absorption. And within these 3 parts, what are the economic levers that can change the food availability and access towards more and more of nutrition? And one key point that emerged out of that, those countries which have been facing shortage of food, the first and highest priority is to increase the production of agriculture by giving incentives, investments, incentives, infrastructure. But once you have produced the food, the next big challenge is to store it well so that reduce the post-harvest losses. There are countries, as in India, large post-harvest losses in perishable commodities. And that requires all along the value chain a lot of investments in infrastructure. So that's what the marketing revolution, even the Prime Minister talked about. And you can use your taxation policies, you can use your price policies to incentivize the system there. On the issue of economic access was that growth is a necessary instrument that will augment the levels of income of the people, but it may not be sufficient to take care of the deficiencies of certain types as far as the nutrition is concerned. So targeted interventions would be needed there. But also, augmenting income would be that only a few people can take full advantage of it. If there are people at the bottom who are left out from the growth process, if the growth process is not broad enough, then how do you take care of them? and we thought that the economic levers could be the conditional cash transfers to them rather than messing up with the pricing structures and pricing controls, which will affect the efficiency and allocation of resources on the other hand. In terms of absorption, there are investments needed, but there are issues which go beyond economic sphere, particularly on the education of the women and all that. Now, when we were looking at all these three, which are the best practices and case studies that we can cite off, where you have given good availability, you have given good access, and it is nutritious food, then issues, one example that came up by the audience was Amul's story is a great success story. Amul's story in this country, which led to Operation Flood in due course, the milk revolution by the smallholders. It was very broad-based. It augmented the income of the people. It required investments all along. So those are the economic levers that you need to put in place. And it also improved the nutrition of the people because it's nutritious food. There was cases that if there are big companies like Nestle that are trying to give Cerelac, but the price is very high. It could be nutritious, but if it is not having economic access of the poor, how do you innovate a different product from your traditional mixtures and put a certification, quality certification, which can compete with these types of things? You can get your millets in place, you can get your other things which are nutritious, and traditionally we know which are those commodities, and you can do that, but it needs quality certification. Now, how do you do that? You do that by bridging the information gap between the producer and the consumer about what nutritious food is. And the last point that I would like to put in place is that the most sustainable solution, economic levers, the discussion came up, would be those which are market friendly. Markets are not a panacea, but they have done better than many state interventions. So if you want to scale up those experiments, you need to look at which foods would be market friendly. That means they are aligning with the consumption preferences of the people. And those foods, if you can innovate and get in right place, in right quantities, at right prices, through the incentive structures, then you are likely to succeed. Thank you very much. 1 second is left. Thank you.
Thank you very much. Perfect. And I'm afraid we will not have the opportunity to entertain questions. Instead, we will sort of rapid fire a number of reports to you, and you poor audience do not have the chance to fire back. So we immediately go to the next report on the social levers, and here we have a little change in the program. The report will be presented by Emily Levitt from AED, Center for Nutrition, and she's working with the Food and Nutrition Technical Assistance Project, FANTA 2 there.
Thank you very much. So Laura Burks wanted to be here today but was called out for another meeting. She is the Senior Nutrition and Food Security Advisor at USAID and did a remarkable job chairing our session but had to leave early. I think our session was really summarized as a how-to session. We've talked a lot about the concepts and the theories and the importance of linking agriculture and nutrition, which hopefully we all believe in, which is why we're here. But our session was really a nice how-to session. Some of the key points as an overview were that we need to involve people, listen to people, and invest in people, and we're not in the business of charity, we're in the business of mobilizing people and working with them and investing in them, depending on the angle that we work on. The other is that we talked a lot about tools, and so some of the examples that I'll mention relate to tools. And in terms of intersectoral collaboration, a theme of this week, something that came up again and again in this how-to related session about working in society with social levers was if you have one concept that mobilizes everyone, a vision, if you can have a visionary champion to cast that vision across the sectors and people can see their piece in it, then it can work, it's effective. So, and it can be prioritized at a high level. So that seemed to be a theme of the different presentations that we had. We had some nice reports back from different countries. One was from Dr. Aranja in Brazil with the Zero Hunger program that President Lula, the former president of Brazil, helped launch to fight hunger. That included an income transfer, school feeding, and restaurant and food bank interventions. They reduced poverty by 50% from 17.5% to 8.5% of the extreme poverty line. So this was demonstrating the poverty of intervention at scale. They found key pieces here were social mobilization and the promotion of healthy diets. So a number of the how-to pieces that we talked about here were about mobilizing people with information and nutrition knowledge. And one person mentioned that when people are aware of what they need to eat and how important it is for their own health and well-being and productivity, that mobilizes them to be agents of change within their own communities. We also heard from Lisa Dreyer from the World Economic Forum, and she mentioned that at the Davos meeting recently, there was a roadmap for stakeholders that has been launched, and that was put together by farmer leaders sitting down with CEOs and heads of state to define how they can work together and create a shared sense of responsibility. They can work together on specific solutions like business models or fortification, and thinking through how to solve the puzzle together. That the private sector has an untapped potential that we can work with. And the private sector is innovative and works very efficiently at large scale, which is something nutrition is looking to do more of. So we have partners in the private sector. 2 minutes, okay. Charlotte Dufour presented a very nice specific case study from Afghanistan and then another piece from Mauritania. But what she said, if you learn anything from what I have to say, is that there's a tool that she has used called the problem-solution tree, where you bring stakeholders together, you define a nutrition problem, and then the people from different sectors explain what the causes of malnutrition are, whether you're in a community or you're in a district government office or at a national ministry level. And she said there's no persuasion required to convince people to care about nutrition, whether they work on roads, communication infrastructure, marketing, health. Everyone sees that they have a role in nutrition, and people can get involved. And in Afghanistan, they worked with they were opportunistic, and they decided to promote nutrition through literacy circles, and there were thousands of them, poultry groups, community health workers, agricultural cooperatives, and they just took every existing platform they could and had common messages, and then there were synergies amongst these different institutions and interventions, and people were getting the same message from many different sources, and they had quite a lot of positive change. And now the Ministry of Agriculture has asked the Parliament for $2 million to continue supporting this work. And this was originally supported by the German government, thank you very much, through FAO. Then we heard from Xing Li, an economist from China with a Swiss reinsurance company, focusing on how public-private partnerships are a good opportunity to increase productivity in the agriculture sector. They've had 7% growth for farmers recently, declining rural poverty and changes in dietary patterns. So they've been working with farmers, and I have 4 seconds. India, incredible program on the Society for the Elimination of Rural Poverty in Andhra Pradesh, 11 million poor women involved, and they've been having dramatic maternal and child health indicator impacts. So my apologies to our Indian colleague who had really remarkable story to share there, but a lot of evidence does exist, and there will be minutes from this program shared.
Thank you very much, Emily. And the next report will be on the session on governance and inclusion levels, and here we also have a change. The report will be given by Robert Madime, and he's the Senior Regional Nutrition Advisor, also from AED, the FANTA 2 project.
Okay. Our team, there were 4 presentations, and one was more of a general presentation, and the other 3 were case studies. And we had like 5 or 6 key outcomes that we can share with you. One is that we need political leadership, and political leadership at all levels for there to be effective integration of all these groups. And then an issue of whether the leadership has actually the capacity to be able to coordinate and facilitate such groups. And there was a discussion that that kind of, building that kind of a capacity is very necessary. Secondly, we also agreed that policies and structures or systems that might be put in place can be by themselves a means of excluding or even exploiting some members of the community, especially the vulnerable ones. And therefore, they have to be thought very carefully how they are done. And that's why this partnership, even with wider kinds of groups, is very necessary. Policies by themselves are not adequate, of course, also to change behavior or to make people behave differently. And there was a discussion that other incentives or incentives also given to people or given to institutions must also be put in place. There must be something that pulls people and not always pushing people to do things. Then there was also a discussion that we must intentionally include the communities and the beneficiaries that we actually work with. There was a discussion that we need to brand nutrition, because only when we brand nutrition, having a slogan or a color or something that makes everybody focus their mind to this one agenda would make people buy into what needs to be done, give the people political voice and also economical voice, but also build their capacity to be able to recognize and address the nutritional problems or other hunger problems that they have. But there was also a discussion that we need to wear a gender lens in all these situations, because most of the problems that cause vulnerabilities actually are related to gender. And then there was also a discussion about paying farmers, and there was a discussion that we should not just think of paying farmers for the products that they just provide or that they grow, but also for public services that they may offer. For instance, there was a discussion that farmers play a very big role in the conservation of soil, in waste management, in planting trees and so on. And the question was, how do we actually reimburse the farmer for this contribution that are for communal good? And lastly, we said all these things that of course need governance, that need capacity building, that needs to create trust and belief between communities takes time. And we need to create that time in the programs that we actually design, because programs just come for a short while and expect lasting results. But all these things require time, and we should actually put that into consideration when designing programs.
Thank you very much.